So the last few years have redefined employee wellbeing, with employers recognising its importance for the whole workforce and how that links to wider business sustainability. I'm very excited to talk today with Sneh Khemka, CEO of Simplyhealth, about future directions in employee wellbeing and also in the provider market. So Sneh, you've been CEO of Simplyhealth for 15 months in a very eventful period for wellbeing. What has been your key focus as leader during that time?
Well, Maggie, first of all, thank you very much indeed for having me today. And it's a pleasure to speak to you about these things, which are very relevant. So the last 15 months has been a really exciting and incredible time for me personally. Simplyhealth is such an amazing organization, and I felt really privileged to take on the CEO position. And especially at a tumultuous time, we are facing into pressures that we haven't seen in many generations in the post-COVID world, with the cost of living crisis, and with NHS provisioning being squeezed really tightly. And so for many employers, there's been a real wake-up call to the need for provision of health and well-being benefits, not only for certain echelons of the workforce, but for the entire workforce, and increasingly so reaching into the families of that workforce. So really, I've been concentrating on two things. One is about what is it that Simplyhealth offers into the market that employers may wish to buy and engage with, and what actually can we do for our own staff as well, because as a leader, investing in our own people to show the case example is very necessary. So on the first question, Simplyhealth and the cash plans and den plans that we offer has never been more relevant. As the NHS funding gets squeezed, it's retreating more and more into inpatient and emergency healthcare services, leaving behind the provisioning of outpatient services, which include GP and primary care, physiotherapy, dental, optical, those sorts of things. So I've been concentrating hard in the last 15 months in making sure our products are fit to be able to provide employees and their families with access solutions. And by that, I mean getting to see somebody, get diagnosed and get sorted quick so that you can be more productive in the workforce. And that's been very relevant for us. And we continue to bring out new products that service that market. And on the other side, with our own employees, we have gone to a fully hybrid working environment post-COVID. And so concentrating on the new dynamic of how people are engaging with work has been something that we've been tackling. We are fully hybrid, and given that people are now on Teams and in their homes, how do we make sure that we are providing them with health and wellbeing services that are relevant to them? A couple of small examples. We've gone to meat-free Wednesdays, which means that we give people a break from their computer screens and doing meetings online on Wednesdays. We've put a lot of effort into our mental health and wellbeing provisioning. We do a lot of online webinars about health and wellbeing topics. We bring in celebrity speakers, and we find that those sorts of events have really engaged our workforce. So really, it's two dynamics there, Maggie. It's what we do commercially and what we do for ourselves as well.
So Sneh, Simplyhealth has recently been given B Corp accredited status. What does that mean for you and for the business?
Well, Maggie, talking about the ESG heritage that we have, getting B Corp certification is a huge thing for us. It's a huge privilege. We are the first health insurance company in the UK to get B Corp certification, and we're one of only 5,000 organizations around the world. And we worked really hard to get that certification, and it's meaningful because it talks about the way that we run ourselves as a company that is here to do good in the world. And our entire being is about making sure that we are contributing to the environment rather than detracting from it, contributing to society, and governing ourselves in a responsible way that means that our customers benefit from our work and not necessarily just shareholders or employees. So it's a big thing for us, and something, a principle that we very much live by.
That's great. Thanks, Sneh. And it's interesting, we're talking about some of the current dynamics that are shaping your thinking. But on the flip side, Simplyhealth is 150 years old. So how do you take that heritage and bring it into the modern age and plan to future-proof it for the next 150 years?
It's a lovely question, Maggie. I mean, to be associated, to be the CEO of a company that's been around for 150 years is a massive privilege. There aren't many organizations like that. But the beauty of it is that Simply Health, when it was created, it is the most modern incarnation of ESG, where everybody's talking about environmental, social, and governance. But really, if you look at our DNA, we are like a mutual. We are a company that's limited by guarantee. So we don't pay shareholders. We are for profit, but all the profit that we make is reinvested into healthcare and into our purpose. And our purpose is to improve access to healthcare for all. And so I think that is more compelling now than it's ever been before, as organizations and companies are tasked with thinking about how they're contributing to society and not just to shareholder value. We are in a really privileged position. And that's why I took the job. So the question is, how do we future-proof for the next 150 years? Well, that really comes from diversification. And so while I talked earlier about the products that we're changing in the market in our core business, we're also diversifying the business and doing new things. So, for example, we have set up the Simply Health Foundry. Now, the Simply Health Foundry is where we take some of our profits and we invest in new startup companies, up to 3 of them a year, and we build them up to a Series A stage. And these companies are doing new things to help people with their health and well-being. So really quite important. We've also set up a venture capital fund called Simply Health Ventures. And through that venture capital fund, what we do is we invest in young companies that we think are really going to change the dynamic of healthcare provision in this country and improve access to healthcare for all. And then next year, we'll be setting up the Simply Health Foundation, which is more of a philanthropic arm, to allow us to give money towards charitable causes and towards research and development, especially in the preventative and predictive space. So really, it's a game of diversification and building further on our lovely DNA and heritage.
That's great. And of course, you've got a clinical background yourself. How has that affected the decisions and the direction of Simply Health from your perspective?
Well, it's something that I've always been very proud about. The fact that I am a clinician by background. So I started off working in the NHS. I was in the NHS for almost 20 years. I was an oncologist. And so having worked at the coalface gives you a realization of what everyday healthcare means to people. Having interacted with patients for a number of years, really understanding what happens at the clinical coalface and actually understanding the workings of the NHS gives me a privileged view. That carries on. I still have my license to practice as a doctor, and that carries on to how I run a business. In running a business and being a modern CEO, really having empathy for your customers and understanding the needs of your end consumers is more important now than ever. And as a clinician, I really feel that my training and my work to now really helps me with that customer centricity. And I try to bring that into our organization. And so I see Simply Health not as a financial services company, but as a healthcare company. And so what we're trying to do is provide health solutions into the market, not just insurance or health financing. And I think that's a real differentiator. I was recently made a professor at the University of Wales for my services to healthcare and to public health. And for me, it's really important to support the public health agenda of this country. I think we face into unique challenges in the next decade or so. And I really want to use that public health thinking to change the landscape of how we support individuals and their families with their healthcare needs.
I think that's great. Thank you. And that's sort of brought us neatly into talking about the evolution of employee wellbeing more generally. And I think we've seen workplace wellbeing undergo a quiet and sometimes not so quiet revolution over the last 5 years, even before COVID-19, and certainly more intensely since then. What would you say are some of the key trends?
So yes, it is a revolution. Definitely. I would say that, I've been sort of in the healthcare market for many years, both on the clinician side, but also on the business side. And what I've seen in the last probably 4 or 5 years has been an acceleration that I haven't seen previously. What is sort of happening is that by stealth or by design, employers are realizing their role in really helping not only their employees, but their families with their health and well-being. I used to work for a large American organization called Aetna, which is a big US health insurer. And of course, in the US, health insurance is essentially paid by the employer for all. And so the investment into health and wellbeing services is de facto. I see the UK going towards an American style trend where the expectation and indeed the mandate now falls on employers to really concentrate on the health and well-being of their employees. Young people coming into the workforce have expectations that their employer will be providing them certain benefits and support. And those benefits span all the way from keeping you well, making sure you stay healthy, helping you to get access to care when you need it, but also giving you emotional and other support, such as with financial stress or bereavement. And so what was traditionally the EAP, the Employee Assistance Program, has really moved into a new era of importance and well-being. And that trend is being seen through the market. We're seeing that in our commercial numbers. We're seeing more and more employers coming to us and asking us for help with their health and well-being services. And I think it's undeniable that this will continue to go forward over the next few years.
And you touched on financial well-being and financial concerns there. And of course, I think something that's front of everyone's mind at the moment is the cost of living crisis, with inflationary pressures set to go even higher. What effect do you think that will have on employee well-being?
Well, interestingly, so we sponsor every year a report that's done with the CIPD. And in that report, we get quite a lot of great findings. We interview over 800 HR professionals. And one of the areas that we found that is still the most lacking in employee benefits provision is support for financial well-being. Not many employers have really taken that on in a meaningful way. And that's becoming an increasing call for help. So we see that through our own provisioning. So as we provision assistance services, we find the number of calls that are going up about financial help and well-being is increasing. And so we hear the horror stories in the news about what people are having to do to make ends meet. And certainly for the next couple of years, that is going to be a unique challenge. Prudent financial planning, the provision of health and well-being benefits, the provision of financial support from the employer, the provision of interest-free loans, things like that. Other things that the employer can possibly do are going to be increasingly in demand from employees. And we're certainly looking at the solutions that we can provide to help with financial well-being as well.
Sure. And I guess some of the other things that we see as being increasingly core parts of employee well-being, such as menopause support and mental health. I mean, for example, our recent well-being research showed that over 3/4 of employers now say they offer support for stress and burnout. How do we take some of those key areas to the next level and make sure they continue to be effective?
Well, there's almost a sort of fashion and a trend to it as to where the concentration goes. So during COVID, there was no doubt that mental health had become a little, a mini crisis. And so lots of organizations suddenly were looking to organizations like ours and saying, what can you do to help us with that mental health burden? That was a brilliant wake-up call to employers as to what the needs are. And I'm pleased to say that there's quite significant provision. So we are very proud ourselves as an organization of the mental health support that we give not only to our own employees, but to our customers as well. And we found a massive surge in the increase in calls. So getting access to a counsellor who you can speak to live, but also with adjunctive services around asynchronous chat or self-directed materials around mental health support has been key. And we find that provisioning is called on quite regularly. Female health has become a big topic in this country over the last few months. You'll see that the government published a report around it. There's a lot of chat, but there's still not enough action. So the CIPD report that I mentioned shows that under a half of employers really have anything that really deals with female health. And again, another wake-up call, understanding about menopause support, but infertility support, peripartum support, maternity support, all of these sorts of things, working mothers support. So we are concentrating really hard on this. And in relation to the first question about the new products that come into the market, we're working really hard on making sure that we've got things that support specifically female health. So, there are new emerging trends that I think will come to the fore as well. But we are beginning to understand that healthcare, really is not one size fits all, and you need to have bespoke solutions to meet the different demographics of your employee base.
Sure, and I'd love to delve a little bit more into some of those new trends that you see emerging.
So I think if you talk about marginalized populations, the LGBTQ plus community within the workforce, we haven't really woken up to the sorts of issues that community faces when trying to seek healthcare. So I think there's going to be a wave of movement around that in particular. So having an average NHS GP appointment with a traditional GP, often that GP will not know what are the specific needs of somebody who belongs to that community. And so making sure that you can provide diversity of clinicians so that they can, a cisgender heterosexual male dealing with a transgender female will not really have a true understanding of their needs. And so being able to provide bespoke support for those communities. And for those communities, things like mental health support, access to fertility and to parenting, all these sorts of things that are quite important. So I think that's one trend that we are going to see increasing. Just as we've had a concentration on female health, I do see an emerging pattern around male health as well. We men, as you well know, are terrible at seeking good healthcare. And so it's actually harder to reach that population, but just as important. Early diagnosis of prostatic issues, early diagnosis of colon-based cancers, early diagnosis of a number of conditions that affect male health in the working population. I see that there's going to be quite a lot of concentration on that as well. But really, the macro trend is, how do I as an employer provide something which is accessible and affordable for my entire workforce? How do I get to a price point which is £5 to £10 a month and not £200 to £300 a month, so that I can affordably give a provisioning that is meaningful to my employee and that allows me to satisfy myself as an employer that I have something for all of my workforce and not just for the few.
That's great. Sneh, thank you so much for your time today. It's been great to catch up and talk about wellbeing trends, present and future. So thank you once again for some fantastic insights.
Thank you, Maggie.